Okay, we have with us today Terry Troy, and I'm Peggy with the CIPM program. Hi, Terry.
Peggy.
Thanks for taking the time to share your story with us. As you know, I will be recording this. I understand that you have been a chronic pain sufferer for some time. About how many years, Terry, have you been suffering with chronic pain?
The 3rd of June, it was 3 years, so 3.5 years.
Okay. And how did your injury occur?
I had a pile of lumber follow me at work while I was delivering them, and broke both ankle bones, 3 bones in my foot, put a big gash in the top of my foot.
And how long has it been since you worked?
3.5 years. That was my last day of work, June 3rd, 08.
Can you briefly describe your condition or the shape you were in prior to coming to our CIPM program?
Well, certainly. I was taking oxycodone pain pills at night after I was active because the problem I have RSDS and in my right foot, and the more active I was, the more it hurt. The less active I was, the less it hurt. So I wasn't very active. And then I got into this program. I no longer had to take the pain medicine. I slept at night. Started out about 4 or 5 hours, but that was great. And then at the end, when I run out of the pills, I was sleeping 6, 7 hours and not getting up in the middle of the night. And if I did get up in the middle of the night, I was able to get back to sleep. Well, I don't have that benefit now.
Yeah. So you were on medications for pain?
Yes.
Okay. While you were in the CIPM program, were you able to take any less of the medications?
I didn't take any of them.
You didn't have to take any of them?
No.
Okay. What are some of the other treatments that you've tried in the past to help with your condition?
Well, I have a spinal cord stimulator implanted, which doesn't work. I've had 3 epidurals, or 2 epidurals, excuse me, and they've helped slightly. And other than the operations on my bones and so on and so forth, I guess that's about it.
How does the Summit CIPM program compare to your previous experiences?
Well, great, because I wasn't as irritable. Stress didn't bother me as much. I didn't smoke as much. I didn't drink as much. And I slept a hell of a lot better. Whoops.
And your status today? How is your general life and how is it improved? Are you active?
No, I am not. Am I active? Yes, because I have to be. But after I run out of your pills or your medicine, whatever you want to call it, I'm right back to the way I was prior to starting this program.
Mm-hmm.
You know, it took about a week. I will say this. It took about a week for where I could really start noticing it. Well, the next 7 weeks were great. So basically, I'm no better off today than I was when I started the program because I'm out of the material and I understand this is what you're calling an exit interview, so I'll interpret that as I'm through with your program.
You might be finished with the program, but you'll always be our patient, and you haven't reached the sustainable relief that we would like to see, so we will continue to see you and get you where we think you should be.
Well, that would be wonderful because you're great people.
Thank you.
You do a heck of a good job.
Thank you. Do you have any advice, or is there anything that you would like to say to someone if they were considering entering the CIPM program?
Definitely do it. I mean, I understand that everybody reacts differently to different programs or procedures or whatever, but I had a wonderful result. You know, for the first time in 3 years, I didn't have to take a Oxycontin, and that was wonderful because I hate them. I mean, some people love them, but I hate them. I don't like the side effects. I don't like, you know, the grumpiness. I'm grumpy enough as it is without taking that crap. So, I mean, anybody that has suffered the injury that I have and continued with a chronic pain like I have, I would definitely recommend it.
Okay, well, thank you for being with us here today. I certainly appreciate your time, Terry.
Well, thank you.
Okay.
Thank you for having me.
No problem.